product of the menstrual cycle. I don't care if you were born via the vagina, or if you were born via cesarean section, or you were adopted, or it was IVF. The menstrual cycle, the reproductive cycle, had a role to play in this. So it's quite essential that we know and that we learn about this. And that is what we're here to look at. So today, basically, from questions and interaction we've been having with the good followers of this podcast, and also from what we've been seeing on social media of recent, we feel that it's needful that we look at something that may look as if it has been quite overlooked. Not because it's been overlooked, but it's been normalized. Sometimes due to lack of knowledge, when things keep happening again and again, people normalize it even when it's not like okay. So today, I want to look at menstrual dysfunction, what we call menstrual disorders. So you see a whole lot of people, maybe especially on anonymous uh, anonymous questions where people ask about what is happening with them, and then they also ask if it is normal. So that is what we're about to look at today, Joe. As a definition, a menstrual dysfunction is simply any disruption from what is normal about the menstrual cycle. So it encompasses so many things, ranging from when there is irregular periods, or when irregular, I mean is shorter than it should be, is longer than it should be, or when there is pain, or when there is excessive bleeding, or when there is infrequent periods, or maybe if there's just painful periods, all of these work into become menstrual dysfunction. But I think that it's important that before we go in there, there's something I want us to like look about. So let's talk about the menstruation and menstrual cycle in general. Now, menstruation and the menstrual cycle. So it's just the cycle that it's also called the female reproductive system, more or less a cycle of changes in the reproductive organ of the female that is greatly controlled by the hormones and also the brain and the hormones, because it's the brain that sends signals to for certain hormones to be released in order for the cycle to in order for the cycle to happen. So so that's something that we need to look at. So when talking about the menstrual cycle, basically four phases as the case may be. We have the menstrual cycle, that's like as at the time the woman is bleeding. We have the luteal phase, and there is also the follicular phase, right? So what this happens is that across all of those stages, so it happens that so to simply define menstrual cycle is that the woman's body prepares to get pregnant. If the pregnancy does not happen, it shapes off and then begins all over again. So that's basically what it is. So hormones are produced that prepares the other accessory sexual organs like the breast to get pregnant. If pregnancy occurs, the baby grows, become a fetus, gets delivered. If pregnancy does not occur, it shapes off. So the major changes is often in the lining of the uterus, the endometrium of the uterus. So when there's no pregnancy, this lining has to shed off as the case may be. But then we want to draw a line between what's normal and what's not normal. So we start with what we call premenstrual syndrome. So premenstrual syndromes are basically a couple of symptoms that begin around a week or two before a period, and sometimes goes into the actual period and then a few days later. So there are certain things that happen. And now, so this is as your body gets ready to reproduce, or the body gets ready that it is not pregnant, as it gets ready to shed off, right? As it gets ready to shed off, there are certain things that happen, and then it gives off certain signs and symptoms. So these are what it is. So these symptoms can be physical, can be emotional, or sometimes a mix of both. In fact, it's these PMS is one of the symptoms of PMS is mood swings, no disorder that we see mostly among our female folk, right? Where men will be like, if you see the woman in your life, a sibling, a friend, a wife, a mother, whosoever it is, and you'll be like, Is it that time of the month? So basically, it's not their fault. It's the effect of the hormones on them. So let's look at some of the physical symptoms. Bloating is a physical symptom where you feel full, right? As if you're full, but then you're not eating, but you feel filled or full. So that's one of the symptoms. We have pelvic pain. So around the region where we have the genitals, there is pain. We have acne or pimples, what we call pimples. It flares up, an increase in acne. And then there is fatigue, generalized body fatigue, where you get tired easily. Then there's breast soreness, headache, and diarrhea, constipation. It could be diarrhea, frequent stooling, frequent watery stool, or it could be constipation, inability to stool. So it differs from person to person. Then for emotional symptoms, we have irritability, mood swing, changes in sex drive, brain fog, feeling anxious, food cravings, then having trouble sleeping. So if you notice this among if you notice this happening to a lady around you, it could be that these are pointers to that the period is just around the corner. So what's the cause of PMS? It's relatively unknown, relatively unknown. Excuse. Sorry about that. So the causes of PMS is relatively unknown, but it's often linked to the changes in hormones. As the hormones fluctuate, go up, come down, majorly estrogen and progesterone, they lead to different changes that manifest like emotional symptoms or maybe physical symptoms, right? So certain people are sensitive to hormonal fluctuation, and that's why the sensitivity differs from person to person. That's why the symptoms of PMS may differ between this person from the other person. So you need to know this. So you're not supposed to expect that because I see this in family where parents are like, yes, you are not the first person to menstruate. Your sister used to menstruate, and it's like, no, it differs from person to person. For some persons, they may be little or no symptoms, and for the other person, it may be for the other person, it may be a problem. It may be a big problem for the person. So it's essential that you look at that. So PMS, the duration for PMS is supposed to be 2 weeks, at most 2 weeks before the period, to about 2 to 3 days after your period. Sorry, not after, before your period. So it should run till the time of your period. Right. So when your period sets in, it should have gone off. So what are the risk factors? Some certain persons are more prone to actually have PMS, which is premenstrual syndrome. People that have a history of depression, postpartum depression especially, a personal or family history of depression, whether it's the real depression or postpartum depression, such people are at risk, and people with high stress levels. So please, when your period is around the corner, reduce your stress level. So the way this is diagnosed is basically by taking the history, which will decide when it is, and then treatment can be given. There can be medication like non-steroidal anti-inflammatory. There can be hormonal medication. Sometimes lifestyle changes like getting regular exercises and eating a diet. So I just wanted us to clear on that before we actually move into the topic for today, which is actually menstrual dysfunction. So, like I said, menstrual dysfunction is a disruption of the normal. Infrequent heavy periods, pains, prolonged period, all these are menstrual dysfunction. So, we're going to look at a couple of them. So, we have the most common one, the one called dysmenorrhea, aka painful menstruation. So, dysmenorrhea is painful menstruation or painful cramps, as the case may be. And it is simply frequent cramps during menstruation. Now, because of the contraction of the hormonal action leading to the contraction of the wall of the uterus, it leads to pain that spread through the lower abdomen, sometimes to the lower back and thighs. So it could be primary, it could be secondary. So it has basically two types. The primary dysmenorrhea is the one that is caused by the menstruation itself, while we have secondary dysmenorrhea that is caused by another problem. So another problem leads to the menstruation being painful and causing cramps. That's a secondary form of dysmenorrhea. Now, there is menorrhagia, heavy bleeding. So this is significantly heavy period. So if you have a heavier than normal flow, it's a pointer to menorrhagia. So heavier than normal could be the number of pads you have to change, how much it soaks up. Then it could also be the length. So a normal period should not last beyond 7 days, right? So if it lasts beyond 7 days, it already is a red flag. So that could be menorrhagia. Menorrhagia could be a symptom of so many disorder. Then we also have the one that comes to the one that is heavy period. So you shouldn't be changing. You shouldn't change more than 4 pads within a period of like 8 hours. It could show that you're having very, very heavy bleeding. So, so we also have metorrhagia, something we call breakthrough bleeding. So a bleeding that occurs at irregular intervals, variable amounts of bleeding occurring between periods. Now, in girls that are just starting to menstruate, this can be quite normal because their body's trying to get in sync, their body's trying to, formulate, and get to be in sync to know how to, for the menstruation to come. But it shouldn't be something that is common with a woman who's been bleeding. Then there's menometrorrhagia. So we have heavy and prolonged bleeding, but the only difference between these and metrorrhagia is that the only difference between these and menorrhagia is that while menorrhagia occurs at regular interval, especially during when your period is supposed to come, men- menometrorrhagia occurs at irregular intervals. So it's a combination of menorrhagia and metrorrhagia. So it just the bleeding can occur sometimes like during your menstruation, sometimes it occurs irregularly at interval. Then there is dysfunctional uterine bleeding, which is any kind of bleeding, any abnormal uterine bleeding, bleeding from the uterus, excessive bleeding caused by hormonal problems, especially when there is lack of ovulation, something we call anovulatory bleeding, when your body does not ovulate but you're still bleeding. Yes, so there are also different kinds of bleeding. Then another dysfunction we can look at is what we call amenorrhea, which is the absence of menstruation. Excuse. Amenorrhea, which is the absence of menstruation. So when this happens, we have two, the primary and the secondary amenorrhea. For primary, it means that this person has never seen her menses. So this girl has never menstruated before. That's the primary form. But if somebody has menstruated before, then on the course of her lifetime, she stops. When she is not yet menopausal, that is secondary amenorrhea. So when somebody used to have a previously regular period, but for like 3 months, such a person has not seen a menstrual period. Such a person is said to have a secondary amenorrhea. Then there is oligomenorrhea, which is infrequent menstruation, meaning that if a cycle occurs 35 days apart, so let's say you bleeded on the 1st of June, and then you notice that it is almost the 5th of July, getting to 16th of July, you're not seeing your period, you're most likely suffering from oligomenorrhea. Then we also have hypomenorrhea, which is scanty menstruation, light menstruation. So this one often happens with girls that are just starting to menstruate, very scanty menstruation. So all these most likely are pointers to hormonal problem. So let's look at one of them, their causes. For this menorrhea, what could be the cause? So this menorrhea is basically caused by action of what we call prostaglandins. So substance in the uterus that causes the muscles to contract. Now, dysmenorrhea could be a pointer to a couple of things. It could be a pointer to endometriosis, which is a disease condition where tissues of the uterus grow outside the uterus. It could also be a pointer to uterine fibroid. So if you're having very severe painful cramps while you're menstruating, oftentimes does not allow you to perform your activity of daily living. It could be it could be likely that it's caused by other factors. It could be a secondary dysmenorrhea, not a primary one. Then pelvic inflammatory disease, ovarian cyst, ectopic pregnancy, intrauterine contraceptive also can lead to this. Then for menorrhagia, which is heavy bleeding, possible causes are hormonal imbalances. I've talked about that. Ovulation problems, uterine fibroids, uterine polyps, endometriosis, and adenomyosis. So all of this could be pointers to why you're bleeding heavily. You could even be bleeding disorders, meaning that when you bleed, your blood cannot clot. For example, when there's a lack of vitamin K, which is the clotting factor. So every time you bleed, when people bleed, your body's supposed to clot so that the bleeding can stop. But sometimes people that lack clotting factors, their body bleeds so much, right? Resulting to heavy bleeding. Then there's cancer. Uterine, ovarian, cervical cancer can cause excessive bleeding that may sometimes disguise the way they go disguise like saying a menstruation. Then pregnancy or miscarriage and what we call implantation bleeding, spotting. Then other medical conditions from disorders, cirrhosis, thyroid diseases could be a problem. So the causes of amenorrhea and oligomenorrhea. So we start with amenorrhea. For primary amenorrhea, when a woman has never seen a period, it could be delayed puberty, meaning that this delayed puberty could be due to issues with hormones or maybe with the organs. So the ovaries, failure of the ovaries to develop to cause menstruation could be a problem. It could also be failure of the needed hormones to be stimulated. Then hormonal changes and puberty could lead to infrequent periods too. Right, weight loss and eating disorder. I think I've said this a couple of times. It's not just about you wanting to lose weight. If you lose weight and you go beyond the normal range as based on your body mass index or your BMI, there's a possibility that as a woman that it will affect your hormone functioning, leading to irregular menstruation or absent cessation of menstruation. This thing can be seen most likely among athletes, especially when they're in the heat of maybe an event, maybe they're preparing for a competition. The stress level also. I talked about athletic training. I talked about the stress level. Then polycystic ovarian syndrome could also be a problem for irregular menstruation or absence of menstruation. Elevated prolactin level could also be a problem because when prolactin is produced, it inhibits the function of the hormones that leads to menstruation. That's estrogen and progesterone. So if you have an increased level of prolactin, it's going to stop the function of estrogen and progesterone, thereby leading to possible cessation of menstruation. Premature ovarian follicle, I've said it before, there's a problem with the ovary. The follicles don't mature like they should. Therefore, meaning there will be no ovulation, then there will be no menstruation. Then structural problems, maybe the tube is blocked, maybe the uterus is blocked, maybe the fallopian tube is absent, the ovaries is absent, whatever it is that could be, then we have other medical condition. So what are the risk factors, possible risk factors for people who may experience any form of menstrual disorder? We have weight. Your weight is important. It shouldn't be too much. You shouldn't be obese. It shouldn't be too little. You know, so you shouldn't be underweight or overweight. Then menstrual cycles and flow. So it is often said that people that bleed longer and have heavier menstrual flow are more likely to have more painful cramps. So heavier and longer flow is associated with painful dysmenorrhea. Then pregnancy history. So for women who have had a higher level of pregnancy, they're more likely to have menorrhagia, which is heavier bleeding. Smoking can increase your risk, stress, and then exercise. So, what are possible complications? Anemia is a possible complication. If you bleed too much, you lose so much blood, and there's a shortage of blood. So, that's anemia for people with menorrhagia. Then, osteoporosis, which is when there's a reduced estrogen level. It could be linked to loss of bone density. That's what we call osteoporosis. So, when this happens, is that when your bone loses its density, you're more likely to have a fracture. So if they, for example, if you have a high prolactin level, it impedes the function of estrogen. Estrogen helps a lady to have a denser bone mass. So when there's no estrogen, the bone density is reduced, linked to more like the higher likelihood of having a fracture. Then there's infertility because, like I said, ovulation is part of the menstrual cycle. So if you have a menstrual disorder, it's most likely you won't ovulate. So you won't menstruate. If you don't ovulate, you can't get pregnant. So infertility comes in. Then the quality of life, because menstrual disorder can affect your work. I know people, so many people, can't do activities of daily living when they're menstruating. They're on the bed, crying, rolling over, so it affects the quality of life. So diagnosis. So you'll be asked about your menstrual cycle pattern. That is why it's essential for you to track your period. So you track your period because you ask about your patterns. Family history also counts in menstrual problems, history of pelvic pain, your use of medication, either you're using vitamin supplement or over-the-counter drugs. Diet counts. Contraceptive use counts because some contraceptive can lead to heavy bleeding, stressful events, and then sexual history. This is important. That's the thing. Then from there, they will proceed to pelvic examination, blood test, ultrasound, or sonography, sonohysterography, which is a kind of sonograph that is done to check the womb or the uterus. So all these are used to check. Then sometimes they may need to proceed to endometrial biopsy to check your endometrium if it's existing outside of your uterus, hysto- hysteroscopy, where there is a view of your uterus to check what may be the problem. Dilatation and curettage, possible history of it, as the case may be. So then, how can you help to, prevent? Let's talk about prevention. So if you want to prevent, depends. So the thing you could do to prevent would be for you to change your lifestyle. The kind of diet you eat counts a whole lot. So food containing hemoglobin, that's iron, is something that you should be taking to help to replace the lost blood during menstruation. Then iron supplements, if need be, if it is recommended. Then exercise can help. Applying heat, compress, hot water bottles, or maybe the battery run and menstrual heat pads can also help. Then sometimes medication, over-the-counter medications, common pain relievers, non-steroidal anti-inflammatory drugs could also help. It is essential that this is done. Sometimes contraceptive is used. Contraceptive can be used as a form of, to correct a disorder, either injection or pills, as the case may be. So these are some things that I've done. But then, if you're having any disorder, emphasis, and it affects your activity of daily living, it's important. It's important that you go to the hospital and get yourself screened. So if any menstrual disorder affects you and stops your activity of daily living, or if you bleed for more than 7 days, you're changing more than 4 pads within a period of 8 hours, right? You have a cycle that is longer than maybe from the first time you saw your period to the next time, longer than 35 to 40 days. All these are pointers that there might be a dysfunction. So today we're talking about sexual dysfunction. We define what it is, talked about the premenstrual syndrome, and then we actually talk about the disorders. So this is what we have for you today. See if you have any problem, you have follow us on all our social media platforms. We already have elaborate content on menstrual disorders and also menstrual products to use as the case may be. We'll be publishing content soon over the next couple of weeks on the right menstrual product to use because some menstrual products you use could also be a problem, right? It could also be a problem for you. It's essential that you know the product to use. So follow us on all our social media platforms. Subscribe to our YouTube channel like you're watching. Share this video to somebody who may need to see this. Follow us on Instagram, on Facebook, on TikTok, and engage with all our content. If you have any question, please reach out to us on our WhatsApp channel. You'll find it in the description, in our YouTube description. Reach out to us. Ask us if there's any topic we want us to discuss, please drop it at the comment section of this video. I'll be glad to share with you. My name is Nosa Fan, and thank you so much for joining our live session today as we discuss mental disorder. Until we come your way next time, please stay safe and do well to engage with us. Your intimacy matters, and that is why we're here on the Intimate Matters podcast. Goodbye.